Hashimoto's thyroiditis is an autoimmune disorder that arises when your body's immune system mistakenly attacks healthy tissues. In this case, the immune system targets the thyroid gland, a small, butterfly-shaped gland located at the base of your neck, just below the Adam's apple. The thyroid is crucial in regulating your body's metabolism through hormone production. However, in people with Hashimoto's, the immune attack damages the thyroid, preventing it from producing sufficient hormones. This leads to hypothyroidism, where the body's metabolism slows down, affecting nearly every organ, including the heart and brain. While anyone can develop Hashimoto's, it is most prevalent in middle-aged women and often requires lifelong treatment to manage hormone levels. In this video, we'll explore the prevalence of Hashimoto's, whether it has a genetic component, current and emerging treatments, and its impact on diet, especially in relation to gluten and pregnancy. We'll also compare Hashimoto's with another common thyroid disorder, Graves' disease, to help you better understand these conditions. Understanding Hashimoto's is crucial not only for those diagnosed, but also for their families, as it often runs in families and requires ongoing management. By the end of this video, you'll have a clearer picture of this condition and the options available for managing it effectively. How common is Hashimoto's thyroiditis? The global prevalence of Hashimoto's thyroiditis in adults is approximately 7.5%. Prevalence varies by economic status: 11.4% in low-middle-income regions, 5.6% in upper-middle-income regions, and 8.4% in high-income regions. Geographic variation in prevalence: Africa, 14.2%, Oceania, 11.0%, South America and Europe, 8.0%, North America, 7.8%, and Asia, 5.8%. Women are about 4 times more likely to develop Hashimoto's thyroiditis than men. The annual incidence of HT is estimated to be between 0.3 and 1.5 cases per 1,000 persons. HT is often associated with other autoimmune diseases, with a higher prevalence of non-thyroidal autoimmune diseases in adults than in children/adolescents. The most common cause of hypothyroidism is Hashimoto's thyroiditis, while iodine deficiency is the most common cause worldwide. Is Hashimoto's thyroiditis genetic? Hashimoto's thyroiditis has a genetic predisposition influenced by immune-related and thyroid-specific genes, environmental factors, and epigenetic influences. It is associated with specific HLA genes, particularly HLA-DR4, DCAR5, and DQW7, which confer a higher risk of developing the disease. There are shared genetic markers between HT and other autoimmune thyroid diseases like Graves' disease, indicating a common genetic predisposition. Studies have identified numerous DEGs in HT patients, many of which are involved in immune and inflammatory responses, oxidative stress, DNA damage, and repair mechanisms. Polymorphisms in genes, such as SCPS1, have been linked to an increased risk of HT, highlighting the role of specific genetic variations in disease susceptibility. HT is frequently observed in individuals with certain genetic syndromes, such as Turner syndrome, Down syndrome, and Klinefelter syndrome, suggesting a genetic link. Family and twin studies provide strong evidence for a genetic influence on HT, with a higher prevalence observed among first-degree relatives and monozygotic twins. Standard treatment options. Levothyroxine can effectively treat Hashimoto's thyroiditis by reducing inflammation, decreasing thyroid volume, normalizing thyroid function, and lowering thyroid antibody levels. Levothyroxine and selenomethionine treatment reduces or normalizes hemostatic disturbances in euthyroid patients with Hashimoto's thyroiditis. Studies suggest thyroid hormone replacement can treat Hashimoto's thyroiditis, particularly once hypothyroidism develops. Selenium supplementation may benefit thyroid autoantibodies and thyroid function by increasing antioxidant activity and upregulating activated TREG cells. Treatment for Hashimoto's thyroiditis is primarily focused on managing hypothyroidism, the most common result of the condition. Since Hashimoto's leads to a decline in thyroid hormone production, the standard treatment involves thyroid hormone replacement therapy. Here's how it is typically managed over a patient's lifetime. 1. Initial diagnosis and treatment. 1. Thyroid hormone replacement. Once diagnosed, most patients start on a synthetic thyroid hormone called levothyroxine. 1. This medication mimics the natural hormone thyroxine, T4, that the thyroid gland produces. 1. Dose adjustment. The initial dose of levothyroxine is often adjusted based on regular blood tests that measure thyroid hormone levels, particularly TSH, thyroid stimulating hormone. 1. The goal is to find the optimal dose that normalizes hormone levels and alleviates symptoms. 2. Regular monitoring. 1. Periodic blood tests. After the optimal dose is established, patients typically have regular follow-up appointments, often every 6 to 12 months, to check TSH levels. 1. These tests ensure that the dosage remains effective as the body's needs can change over time. 1. Symptom monitoring. Patients are also monitored for any symptoms of overtreatment, for example, nervousness, rapid heartbeat, or undertreatment, for example, fatigue, weight gain, which could indicate the need for dosage adjustments. 3. Adjustments due to life changes. 1. Pregnancy. Women with Hashimoto's may need increased doses of levothyroxine during pregnancy because the body's hormone needs rise. 1. Close monitoring is essential to ensure healthy thyroid hormone levels for both mother and baby. 1. Aging. As patients age, their metabolism may slow down, which can alter how the body processes the medication. 1. Dose adjustments may be necessary to avoid overtreatment. 1. Other medical conditions or medications. Certain conditions or medications can affect thyroid hormone levels or how the body absorbs levothyroxine. 1. Regular communication with a healthcare provider is essential to manage these changes effectively. 4. Lifelong commitment. 1. Consistency in medication. To maintain stable hormone levels, it's crucial that patients take their medication consistently, usually on an empty stomach. 1. Awareness of symptoms. Over time, patients become more attuned to the signs that their thyroid hormone levels might be off, prompting them to seek medical advice for potential dose adjustments. 5. Emerging treatments. 1. Potential new therapies. While levothyroxine remains the standard treatment, research is ongoing into new therapies that might directly target the autoimmune aspect of Hashimoto's. 1. Patients should stay informed about new developments that could impact their treatment in the future. New treatment developments. Emerging studies suggest that various immunomodulatory therapies, including genistein, michigan, C, vitamin D, HAECs, selenium, MSCs, and myoinositol plus selenium, can improve thyroid function and reduce autoantibodies in Hashimoto's thyroiditis patients. Gluten and Hashimoto's thyroiditis. A gluten-free diet may benefit thyroid function and reduce inflammation in Hashimoto's thyroiditis, while other studies indicate insufficient evidence and potential negative impacts on vitamin D benefits. A 2023 study in Turkey found that dietary interventions, particularly the Mediterranean and gluten-free diets, may benefit thyroid function and autoimmune markers in patients with Hashimoto's thyroiditis. However, the results indicate that these benefits might be partly due to weight loss associated with the interventions. Other studies suggest that it isn't quite cut and dry. Gluten exclusion might increase the risk of HT development due to potential nutritional deficiencies associated with low-quality gluten-free products. Maintaining a balanced diet rich in essential nutrients like zinc, selenium, iodine, vitamin D3, and iron is crucial for thyroid health. A systematic review concluded that there is insufficient evidence to support a gluten-free diet for all Hashimoto's thyroiditis patients. Hashimoto's and pregnancy. During pregnancy, women with HT often experience elevated thyroid-stimulating hormone, TSH, levels and reduced serum-free thyroxine, which can lead to adverse outcomes such as abortion, preterm delivery, and reduced intellectual function in offspring. This necessitates careful monitoring and adjustment of thyroid hormone replacement therapy during and after pregnancy. Hypothyroidism in women of reproductive age and can negatively impact fertility. Women with HT may face challenges such as ovarian insufficiency and a reduced reproductive lifespan, particularly if they have positive antithyroid peroxidase, TPO antibodies. HT can lead to various pregnancy complications, including recurrent miscarriage and unexplained infertility. The presence of thyroid autoantibodies and the need for strict thyroid hormone supplementation are critical factors influencing pregnancy outcomes. Postpartum thyroiditis is a common occurrence in women with underlying HT. The thyroid gland undergoes significant changes during pregnancy, and the postpartum period can see a progression of autoimmune thyroid destruction, necessitating increased levothyroxine requirements. Although rare, congenital hypothyroidism can occur in neonates born to mothers with HT. Early screening and treatment with thyroxine are essential to prevent complications related to the central nervous system. Managing Hashimoto's thyroiditis during pregnancy is crucial for the health of both the mother and the baby. Here are some key guidelines. 1. Regular monitoring. Ensure frequent monitoring of thyroid hormone levels, TSH-free T4 throughout pregnancy, especially in the first trimester, to adjust medication as needed. 2. Medication management. Continue taking levothyroxine, adjusting the dose under the guidance of a healthcare provider to maintain optimal thyroid hormone levels. 3. Prenatal vitamins. Take prenatal vitamins that do not interfere with thyroid medication absorption. 3. Avoid supplements containing high doses of iodine unless prescribed. 4. Diet and nutrition. Maintain a balanced diet rich in selenium and zinc, which are beneficial for thyroid function, while avoiding excessive iodine. 5. Close communication. Stay close with your healthcare team, including an endocrinologist and obstetrician, to ensure all aspects of your thyroid health are managed effectively during pregnancy. Hashimoto's versus Graves' disease. Hashimoto's thyroiditis and Graves' disease are both autoimmune disorders affecting the thyroid gland, but they have opposite effects on thyroid function. Hashimoto's thyroiditis. 1. Cause. The immune system attacks the thyroid, leading to inflammation and eventual hypothyroidism, underactive thyroid. 2. Symptoms: fatigue, weight gain, sensitivity to cold, and depression. 3. Treatment: lifelong thyroid hormone replacement therapy. Graves' disease. 1. Cause: the immune system stimulates the thyroid, causing hypothyroidism, overactive thyroid. 2. Symptoms: weight loss, rapid heartbeat, heat intolerance, and Graves' ophthalmopathy, eye bulging. 3. Treatment: antithyroid drugs, radioactive iodine, or surgery. While both are autoimmune, Hashimoto's results in reduced thyroid activity, whereas Graves' increases it. Symptoms: 1. Hashimoto's thyroiditis. Symptoms often develop slowly and include fatigue, weight gain, sensitivity to cold, dry skin, constipation, depression, and muscle aches. 2. Graves' disease. The symptoms are more acute, including weight loss, rapid heartbeat, tremors, heat intolerance, and, in some cases, eye issues like bulging, Graves' ophthalmopathy. Treatment: 1. Hashimoto's thyroiditis. Treated with thyroid hormone replacement therapy, typically with levothyroxine, to maintain normal hormone levels. 2. Graves' disease. Treated with antithyroid medications, for example, methimazole, radioactive iodine, or thyroidectomy, surgical removal of the thyroid, depending on the severity and patient preference. These treatments reflect the condition's opposite effects on thyroid function, underactivity in Hashimoto's versus overactivity in Graves'. Conclusion: correct diagnosis and personalized treatment plans are crucial for effectively managing Hashimoto's thyroiditis and Graves' disease due to their opposing effects on thyroid function. Misdiagnosis or generic treatment can worsen symptoms or cause new health issues. A tailored approach ensures that each patient's specific needs are met, improving outcomes by stabilizing hormone levels, alleviating symptoms, and reducing the risk of complications. This personalized care is essential for long-term health and quality of life. In this video, we covered the essentials of Hashimoto's thyroiditis, including its prevalence, genetic factors, standard and emerging treatments, the impact of diet, especially gluten, and management during pregnancy. We also compared Hashimoto's with Graves' disease, highlighting their opposite effects on thyroid function. If you suspect you have Hashimoto's or have been diagnosed, it's crucial to consult your healthcare provider for personalized advice. For more health insights, please like, comment, and subscribe to our channel